Top 5 Deadly Dog Diseases.
Know the signs and symptoms.
Here is the list of the 5 most common and highly dangerous illnesses in theworld or canines. By properly pinpointing telltale symptoms, you can effectively prolong the life of your pet and build a more harmonious and healthy family life, all with your precious pet in tow.
Canine distemper. This is considered to be the most fatal viral diseases all over the world. Statistics show that there is approximately 90% probability of death for dogs diagnosed with canine distemper and 50% chances of non-immunized and non-vaccinated dogs to contract this highly dreaded disease.
Symptoms: gastrointestinal and respiratory symptoms such as conjunctivitis, diarrhea, fever, pneumonia, rhinitis, vomiting, paralysis, seizures, progressive deterioration of mental abilities.
Treatment. There is no known cure for canine distemper, although one can offer supportive treatment that includes providing a warm environment, keeping eyes and noses free from any discharges, provide medications for diarrhea and antibiotics for pneumonia.
Preventive measures. Vaccination is still the best prevention for canine distemper since it is known to work even if the animal is exposed to the virus, providing it is efficiently administered within 4 days. To effectively ensure long-lasting immunity, dogs should be providing annual vaccinations.
Canine para-influenza. This type of disease is considered to be one of the highly contagious respiratory canine illnesses and largely contributes to the possibility of contracting upper respiratory diseases and infectious tracheobronchitis.
Symptoms. This particular disease mimics kennel coughing symptoms, thus in some cases the virus are often mistaken as such. 10-21 days of coughing despite antibiotic treatments. Purulent nasal discharges. Low-grade fever. Pneumonia. Increased respiratory effort and rate. Possible consolidation of lung lobes.
Treatment. As majority of the viral infections, treatment is largely considered as supportive. Proper nutrition and providing a clean environment considerably help dogs kick up their immune system in response to the virus. A broad-spectrum bacterial antimicrobial prescription can help relieve nasal discharges along with hydration through intravenous fluids.
Prevention and control. Although no vaccine has been introduced to ward off canine para-influenza, dog owners can adeptly prevent the infliction of such diseases by taking insecurity precautions.
Infectious canine hepatitis. Canine hepatitis is a liver condition that can also affect other major internal organs caused by canine adenovirus type 1. This particular virus can actually be found worldwide. Unvaccinated dogs are more at risk with contracting infectious canine hepatitis and are known to be more prevalent with puppies less than 1 year of age.
Symptoms. The primary target of the virus are the tonsils and the larynx that causes sore throats, mild coughing, and pneumonia. As the virus enters the bloodstreams, more prominent symptoms can be noticed such as cloudy cornea, or what is more commonly known as hepatitis blue eyes. In severe cases, the liver and kidneys starts to fail. Dogs experiences seizures and vomiting along with diarrhea and extreme thirst.
Treatment and prevention. Like other aforementioned canine diseases, there are actually no specific treatments for canine hepatitis, and only intravenous fluids and supportive treatment are recommended.
Rabies. Of all the introduced canine diseases, one of the most feared is the rabies, as the virus attacks the brain of the dog and is known to be highly fatal. This disease can also be transmitted to humans and other animals.
Symptoms. After contact with virus, the dog goes through several stages. There are some reported cases of bitten dogs that have shown any symptoms but can't possibly be a lifelong carrier. The incubation period is between 3 to 8 weeks and shows the following symptoms: apprehension and anxiety, fever, irritability and erratic behavior, labored breathing, respiratory failure.
Treatment. There are no known treatment rabies, and if the virus has reached several stages, death is imminent even in humans. However, post-exposure treatment will include 1 shot of rabies immunoglobulin and 5 doses of rabies vaccines. Canine Parvovirus. This is a highly contagious viral disease that afflicts dogs of all ages, but is known to be especially deadly in puppies since it often leads to death within 48-72 hours of exposure.
Symptoms. There have been some cases where dogs may have parvovirus but doesn't outwardly show sign of telltale symptoms on the onset. However, after some time, more often than not, dogs are known to display noticeable and alarming symptoms such as difficulty in breathing, extreme depression, unwillingness to nurse, irregular heartbeat, vomiting, loss of appetite, diarrhea.
Treatment. The primary key in the treatment of parvovirus is maintaining, as much as possible, the natural body composition, at the same time preventing bacterial infection. Since this is essentially a virus, there is no cure. However, in the early stages, fluid therapy would be the most important factor in treating infected dogs.
Love your dog. Please do subscribe our channel and stay with us. Thank you for watching this video. Bye bye.